everyone. Thank you very much for having me here today. I'm going to talk about our project using Yelp reviews to identify foodborne outbreaks. So just a little bit of background. 1 in 6 Americans, or 48 million people, get sick from a foodborne disease each year, and approximately 50% of outbreaks are restaurant-related. And in New York City, you can see that that can present an interesting challenge because we have a huge number of restaurants, over 24,000 restaurants and a lot of grocery stores, and New Yorkers eat out a lot. The way we typically identify outbreaks is that people can call 311 to complain about a foodborne illness. So we get about 3,000 complaints a year. And out of those complaints, only about 30 restaurant-related outbreaks are identified. But we know that there's a lot of unreported foodborne illness out there, and this is a constant challenge that we have, especially with outbreaks, because we want to find these outbreaks so we can figure out the problems and control the, reach out to the restaurants and figure out what's going on. So a few years back, while we were investigating an outbreak in 2011, we noted that there were illnesses posted in Yelp, but those people had not called 311 to report. And we know that online review sites are becoming increasingly common for just posting any type of review, positive reviews and negative reviews. So we developed a collaboration with Columbia University with their Department of Computer Science, and we also worked with Yelp to use restaurant reviews to identify unreported foodborne disease complaints. Oops. And basically what we were doing was kind of Columbia helped us build a text classifier program to extract keywords, detect temporal statements, and multiple illness reports. And we scored these reviews on 3 criteria learned from a training set of manually labeled examples. So we pulled a bunch of data, we went through them and kind of said, this is a real illness, this is not a real illness. And we used certain keywords, we looked for more than 1 person sick, we looked for a relevant incubation period, and we investigated ones that had an average score that was above a certain point. And then at that point, there was a human review component. We had to go through and read those reviews and determine whether or not there really was an episode of illness related to a restaurant. Was the illness occurring recently? A lot of people who post on Yelp, or not a lot of people, but sometimes people will review a restaurant where they ate a year ago, and that's not something that we can really do anything about. Were there multiple people sick, or was there a severe illness that occurred? And then we, me and my staff, we actually contact the reviewers by phone. Imagine that. We talk to them, and we get additional information that we need to conduct a foodborne disease outbreak investigation. And our outbreak investigations are pretty labor-intensive. We interview all the people who might have eaten. We inspect the restaurant. We collect and test patient food samples. So this is just to give you an idea of the different types of reviews that we get. In this first review, we get a lot of these. And this is why we need the human review component, because our text classifier is going to pull this review as a potential illness, but clearly it's not a potential illness. It's someone that wants to say really great things about the restaurant, and I don't care about those. So this is just to give you an idea. This is really just a pilot project, but the first couple of years, the text classifier program has pulled about 4,000 reviews as possible foodborne complaints. And out of those, we've identified 6 outbreaks that we would not have heard about if we weren't doing this project. So it's been really, a really successful project. So less than 10% of the complaints that we identified in Yelp were also reported to the health department. So we really know that social media data is an untapped resource of finding potential complaints. The Yelp reviews provide information on restaurants that may pose a public health risk. And this project is really unique because it provides useful information, but that we go and validate the reviews that are pulled by a text classifier. So we're not just relying on the text classifier to tell us what's going on out there. We then try to contact people and make sure that they're really having an illness. So we're really excited about all the things that we have planned. We want to add additional sources of social media data. So we're borrowing from Chicago's Code for America project, which they, I think, did last year or the year before to look at Twitter data to identify foodborne complaints. We want to continue to refine the machine learning aspect of this. There is a lot of human resources that go into it, so we want to continue to work with Columbia to refine the text classifier, maybe rely more on the machine learning to really help us pull real illness cases, and then continue our partnerships with academic, private, and other government agencies, including the Chicago Department of Health. And I want to acknowledge all of my colleagues, and thank you very much.